And I can say this now with some degree of authority that the methodologies, the traditional care, the treatments, and even some of the surgeries that we've been doing for the last 25 to 30 years in cardiovascular disease are misdirected. They're obsolete and they're very limited in their scope. Rather than saying, well, you've got a high cholesterol, let's put you on a statin and get it down and you'll be okay. That's the wrong message. The message should be, you have inflamed arteries and an inflamed heart. And there's 400 reasons for that. Not one or two. So let's see if we can figure out what it is in you that's making your heart and your arteries inflamed. And go back to the beginning. Ask the question, why? Not just, here's a prescription to go take to fix what I found in my 1-minute visit with you. This is a huge problem in this country. Just high blood pressure alone is 74 million patients. Those who have heart disease are 17 million. We have 7 million people that have strokes. That's 98 million U.S. patients that have heart disease. The cost for that is $70 to $80 billion a year. And I can tell you, if we did the right thing with preventive cardiology, we could reduce the frequency by 70 to 80%, and that cost would drop by an equivalent amount. One in every 3 deaths in this country is a cardiovascular death. So it's 2,200 deaths per day just from heart disease and stroke. And we could reduce that, if we did the right things, to 70 to 80% less. A clear message. We're not doing anything right when half the population are still having heart attacks despite what we consider traditional therapies. So we have reached a limit in our ability to reduce cardiovascular disease based on our present medical treatments. We are a pharmacologically driven country. We are not a preventative medicine country. But if you're talking about preventing the heart attack, we are the worst. We spend more money per capita than any country in the world and have the worst outcomes. But in this country, what's kind of taken over the news media? What's taken over the pharmacologic media? What's taken over your doctor's office? We hear it every day, 15 times a day if you watch television. Statin, 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 cholesterol, cholesterol. Get your cholesterol down. I mean, the commercials regarding statins and cholesterol are almost as bad as the ones regarding erectile dysfunction. So the cholesterol-centric idea of reducing heart disease is really misleading. And I'll show you some data in a few minutes that if you look at your cholesterol level and you treat it with a statin, 50 to 75% of you still have a heart attack. So here is the big picture. If you have all these insults out there in your environment floating around, and there's infinite numbers of insults. You can pick anything you want to. Pollution in the air, bad water, pesticides in your food, organocides, or any of these risk factors, heavy metal toxicity. Pick anything you want. That's an insult. Those are infinite. Those infinite insults attack your artery. Your blood vessel then says, okay, I'm going to do what I'm supposed to do. I'm going to defend myself from this insult. So it mounts a defensive attack. So the next concept is what we call continuum of risk. So you go into your physician's office and say, your blood pressure is 140 over 90. It needs to be 120 over 80. It's so borderline, I'm not sure we need to do anything about it. Well, at 140 over 90 versus 120 over 80, you're already at increased risk for having something happen. Because every 1 point that your blood pressure goes up, there's an increasing risk for heart attack and stroke. It's a continuum of risk. There's no cutoff point. It doesn't, you get to 125 over 88 and then you're out of the woods. That's not that way it works. It's a continuum of risk going up and going down. That's true for everything. It's true for your bad cholesterol. It's true for your blood sugar. It's true for how many cigarettes you smoke. It's true for your weight and your fat tissue, and vice versa. So we have tests that will actually measure non-invasively your arterial health now. 2 minutes. In 2 minutes, I can tell you the risk of a heart attack or a stroke in the future. I can tell you how old you are based on your blood vessels. And here's what gets your attention. The lady comes in the office, she's 40, and I do this test on her, and I said, your tests show that you're 70. And she says, oh no, I don't want to be 70. What do I need to do? So immediately everything switches. She wants to change her whole life to get back to her actual age. Because the biological age and the chronological age don't always match up. Here's what this really says. A lot of vegetables, a lot of colors, a lot of good fruit, a lot of spices. Organic, in my opinion, is very important. I know it's expensive, but let me tell you. You know it was in our food supply and our water supply, you'd be scared to death. And I know, unfortunately. So I'm scared. So you should be too. Pesticides, organicides, hormones. But when your blood sugar goes up or your triglycerides go up, every time you eat, you have what's called endotoxemia. You remember that when women were using tampons and endotoxic shock? Remember that? That was some staph, some bad bacteria. So endotoxemia is a bad infection. So when you eat, you carry not only the bad nutrients across, you carry bacteria across as well. That's the endotoxemia. Then you remember what happens. That's the metabolic memory. So there's... And here's the scary thing. 50 to 75% of patients hospitalized with an acute heart attack have normal cholesterol levels as defined by our present standards. And up to 50% of those who have a heart attack have none of the top 5 risk factors at all. So the new standard of care for hypertension is 24-hour blood pressure monitoring. Okay? So I'm going to stop there. Caloric restriction in heart disease, very important. Caloric restriction made simple. Here's what you do. Okay? Every caloric restriction should be easy. Don't eat after 6 p.m. at night for 4 days a week. So a 12-hour fast. Okay? And if you do that one thing, you'll simulate some of the clinical studies of caloric restriction. So it's not so much the calories per se, it's the 12-hour fast. But in essence, what you want to do is get about a 25% caloric restriction overall. But do 12.5 on your calorie side and 12.5 on your exercise side. That's 25%. And then the rest of it's a 12-hour fast overnight. So are there things you can do to clean out the arteries? Yes. I'll give you 4 things that are natural. Okay? Vitamin K2, MK7. K2, it's a form of vitamin K. Aged garlic. Omega-3 fatty acids. And then there's a couple of drugs like ACE inhibitors and ARBs. Stress is a major heart problem. Can you discuss its features? The main problem with stress is it increases cortisol and adrenaline levels, activates the immune system, and causes high blood sugar and other issues that affects the other risk factors. So, in effect, any type of stress, anxiety, or chronic depression is bad for your heart. Acupuncture is great for a lot of things. No data on increasing HDL that I'm aware of directly. Endo